My name is Andreas Wack. I work at the CRIC in London, and I will organize a Keystone meeting next year, so 2023 in April, about lung inflammation. The organizers are Cecilia Johansson from London, Ivan Zanoni from Harvard, and me for this meeting. For me, this was really a dream coming true in a way, because I think what everyone in the lung infection field notices is the immunologists need to know much more about development, and the lung development people who increasingly use infection models as a very convenient damage inducers to study repair, they should know more about immunology. And so to bring these two fields together is really a fantastic thing, and it's going to happen in a very natural way by pairing up these two meetings, and I think this is fantastic. It will be about how the immune response can either promote or hinder the correct repair of lung tissue, with short-term consequences, but also long-term consequences for lung function. And as we all know, with years of COVID, there are not only the short-term consequences, but also long COVID is also affecting the lung. So these things are very important, and while the developmental biologists and the immunologists really started from pretty separate points, they're coming more and more together, and I think the more we talk, the better it is, and this is really, for me, the great thing about this meeting. It will certainly be about all respiratory viruses that are relevant, so it will of course be about SARS-CoV-2, it will be about influenza virus, there will certainly be talks about RSV, and then we have to see what the abstracts bring in. Since we know that virus bacterial co-infections are important in many diseases, of course we are quite happy to accommodate also people who are mainly interested in bacterial infections, because that's just as important and is part of the context of viral infections. I think scientifically it will be about how we can redirect the repair processes in a way that they can reduce severity in an ongoing acute response, but also how we can prevent long-term dysfunctionality of the lung, or even reverse it if it happens. The place we want to get to is really to have a better grasp of how immune responses can positively influence the right type of repair, or can hinder it, or prevent it, or delay it. And one could argue that, maybe right or wrong, but one could argue with every future pandemic, we most likely will have to deal with a completely new virus. Therefore, all the antivirals have to be reinvented from scratch. But a lot of the immune response aspects are pretty stereotypical. So therefore, we should find ways to prepare in that area much better, and maybe have something really ready to use, even for a virus that we don't know yet which one it is going to be. What we hope is going to happen in the next years is that immunomodulation, with a view onto how do stromal cells and epithelial cells react to the immune components generated in an infection, that this field is going to be taking off, and that is where I hope that we can spark off directions of future treatments. I think everyone who's interested in lung infection and lung repair should attend, and I think all the immunologists should attend, so that they can learn more about the aspects of lung development, about epithelial stem cells, about other stromal cells, and vice versa. Please send abstracts. We hope to get a lot of great abstracts. There will be workshops, and therefore we try to have as many junior talks as we can. And I think in particular for the youngsters, it is a good occasion to get the other side of the story on the radar. So all youngsters, please come, please send great abstracts, and we will try to get as many of you into the presentation programs as possible.